Good morning po at magandang gabi sa lahat. Welcome po sa Global Nurse TV. Kilala niyo ba mga kapatid ng ating bisita ngayon? Walang iba kundi si Sir Brian Caballes. Sir Brian, kamusta naman kayo, sir?
Okay naman, sir. Really good. From here, the land down under, sa Australia.
Wow, long time no see, sir. Kamusta ka ba dyan? Ang ganda ng
Okay
background mo
lang.
dyan, ha?
Thank you.
Pwede ba kabuksan yan, yung isa dyan sa likod mo?
Pwede. Pwede.
Yummy. Sige, mamaya, shot natin yan, pare. Ayun, Brian. So, Brian, bago tayo mag-start, ako rin si Brian, estudyante ko to sa De La Salle pa, no? 2007 batch pa, Brian, tama?
First batch of nursing graduates.
Proud first batch yan ng De La Salle pa, College of Nursing. Sir Brian, pwede mo ba mag-shoutout ka muna dyan sa mga kaibigan mo, mga CI mo dati, kung naalala mo pa sila?
Oo naman, sir. Shoutout ko yung main barkada ko sa La Salle pa, sina Julius, Marion, Gian, Edwin, Nordic, Nico, and sa mga hindi ko na banggit, kilala nyo na kung sino kayo. And sa Cath Lab Mafia ng hospital na pinagtatrabaho ako. Ayun po. Sa mga CI, sina Ma'am Barte, Ma'am Panyaga, Ma'am Bakong, si Dean Urbi, Ma'am Hera. Kumusta po kayo?
Ayun, Brian. Malamang matutuwa sila sa inyan. Sir Brian, umpisa na natin, no? Siyempre, yung College of Nursing, paano ba yung nursing mo? Yung ba, ginusto mo talaga yan? O paano ba?
Lagi kong kino-quote si Jokoy sa
Si Jokoy.
Kung bakit ako naging nurse. It's my mom's decision.
Tama talaga si Mami.
Pero yung first choice ko talaga is it's more of religious studies eh. It's either pathway to become a priest or in some other ways religious path kasi high school ako na-entice ako na mag-attend ng minor seminary pero hindi ako pinayagan. So yun.
So ganun pala ang kwento. So hindi ka naman tawag dito, hindi mo naman kinontra si Mami at first.
Kasi siya magbabayad eh. Yeah, no choice.
No choice talaga. So Brian, so after mong of course naipasa mo ng exam natin, di ba? Sa Pilipinas, yung ba ay nag-hospital ka kaagad?
So after graduation, sir, sa dami ng surplus of nurses nung mga bandang early 2000s, mid 2007s, late 2010s. Parang volunteer ang trend nun kasi mahirap makakuha ng parang permanent employment. So I was a volunteer for about nearly 6 months sa isang district hospital sa Batangas, sa Cuenca. And after nun, I was reviewing for IELTS then. Kasi I was destined to go to New Zealand. Because of my parents, nandun sila. And then they sponsored me. And then I have to pass the IELTS that shamefully, I have to do it 4 times. Kasi mahirap yung standards ng English ng New Zealand. Yung New Zealand noon. This was around 2008. And then, ang nangyari noon is naipasa ko si IELTS and then na-convert na siya sa from Philippine license to New Zealand nurse registry. Pero you have to do 3 months of bridging course. And you have to pay for it. Pero whilst nag-bridging course ako, naging healthcare assistant din ako. So para siyang caregiver sa hospital.
Yung ba
Parang
yung
ano,
bridging course mo, anong ano yun? Nursing din? Anong mga subject dyan? Ano bang?
nurse. Parang ano siya, parang introduction and the ways of doing nursing in New Zealand.
Mm,
So yon. And then yan nakapag-work ako sa mga major hospitals sa New Zealand. And then naisip namin yung palang New Zealand registration, meron siyang tinatawag na Trans-Tasman Agreement. So it means Australia and New Zealand may reciprocity. So you just have to apply. Parang wala na exam. So you just have to apply for that registration and then yun, registered ka na rin sa Australia.
bilis na
So,
din pala, no?
So yun, parang hinintay ko lang yung citizenship ko for New Zealand and then nag-fly na kami ng family ko. So isa pa lang ang anak ko nun. And then nag-fly na kami sa Melbourne, Australia.
Mhm. So ibig sabihin, Brian, nakailang years ka sa Pilipinas na as a nurse?
Less than a year.
Less than a year lang.
Less than a year.
Lumipad ka na kagad, New Zealand na agad.
New
Nakailang
Zealand.
years ka sa New Zealand?
Bale 2008, 2007 till 2013. So almost 5.5, I think.
Wow, matagal-tagal din.
And then plus dito sa Australia nearly 10 years. So next year 10 years.
Wow. I-celebrate natin yan, Brian.
Oh. Yun pa.
Ayan, so umpisa natin yung journey mo naman as a nurse sa Australia. So, paano mo pinasok yung Cath lab na area dyan? Paano nag-umpisa yun?
It's been a while, right? So, ano siya, bale, ang first job ko dito sa Australia is as an agency nurse. So they just call me when they need me. Different hospitals, different settings, and then different areas. So may expose ka talaga, like it's like a crash course talaga. Hindi mo alam yung area, but you have to be there kasi you're being paid to be there by the hour. Ayan. Tapos after nun, so sa iba't ibang hospital, public means government hospital, and then private, which is funded by the private institutions or a not-for-profit one. So yun. And then after nun, may yung isang private hospital, inofferan ako ng permanent position in an orthopedic ward of all places. So orthopedic ward, and then I stayed there for 18 months, and then I nearly got the position of assistant manager, but I declined. Kasi
Bakit naman nangyari?
I think for me, para sa akin po is it's hard to say, pero leadership is not my strong suit.
Okay.
So yun, it's more of me, parang kagaya nyo, sir, education. I'm more of sharing my knowledge, kumbaga. And I'll show you the simplest possible way to do things, and then yun po. And then after nun, parang ako, I got sick of being an orthopedic nurse. So nag-apply ako for theater, so operating theater. Hindi ako natanggap. So dalawa yung in-apply ko, operating theater and cath lab. In the same hospital, so internal application. And then I said, look, I'll just give it a go. You never know kung anong pwede kong marating. So mapasok. Pero ang gusto ko talaga is theater. Like any areas of theater. Pero ang tumanggap sa akin, cath lab.
Talagang para dyan ka sa cath lab na yan.
Yan. And then probation period for 3 months. And then napasa ko yung probation period ko. And then yun. Medyo personal ko yung manager ko noon, yung boss ko. Sabi ko, Boss, bakit mo inhire? Ang sagot sa akin, wala naman kasi ibang nag-apply eh.
Yun ang sabi ko na tanong sa'yo eh. Kung ano yung qualification na bit mo para tanggapin kanila.
Actually, ang qualification to be a cath lab nurse is at least you've been in an acute medical or surgical department for about 12 to 18 months. And then you have a qualified registration, police checks, and everything. Good English, number one yun. Yeah. So yun lang. Doon sa area namin. But to excel, marami pa silang hinihingi na parang it's not more of hindi siya sir yung parang university level na mag-aano ka na continuous studying. It's more of you tick off the boxes. Kumbaga, if you can do this, you're qualified. Wow. You don't have to go to university. Kasi para sa kanila, skills matters. If you can do it, if you can prove that you are safe, you are reliable, and you're professional about what you're doing, you don't have to show a lot of papers.
Wow.
Lenient po ang Australia. Kung in terms of skills and nursing managements.
Wow. So Brian, ilang years ka na dyan sa area mo ngayon?
Bale 2015. So 7 years.
Wow, 7 years na.
Yeah.
So Brian, ano ba yung dapat na maging attitude o katangian ng isang cath lab nurse para tumagal sa area na yan?
Number one po, sir, you have to be really fit. Like you have to be really, really fit. Kasi ang shifting namin dito is almost 10 hours a day. 10 hours a day, and then with an option of overtime. And you're wearing lead shield, lead apron for that 10 hours. At least 8 hours of those 10 hours.
So yung lead apron na, gano'ng kabigat yan?
At least 5 to 8 kilos of your body weight.
Wow.
Yes, sir.
Bigat niyan ah.
Yep. It is primal kasi ano po yan eh, parang that's your number one protection against radiation. And another quality of being a cath lab nurse, you have to be really resilient, and your critical thinking is have to be on point. Kasi po mahirap po yung parang nung estudyante ka, parang mental block ka. It is okay not from time to time na mental block ka, as long as you know you have someone on your back, like there's many of you to think in a certain situation, like in a setting na nasa lab ka, because we call it lab talaga, because cath lab is part diagnostic, part interventional. We study before we intervene.
Wow, ganun dyan. So Brian, pwede mo ba maikwento sa amin kung anong laman ng cath lab nyo?
So in a cath lab setting, number one is X-ray with continuous multiple frame fluoroscopy X-ray machine. I have to have an anesthetic machine, defibrillator, of course, catheters, wires, balloons, stents, and drugs. Another vital component ng cath lab is drugs, emergency drugs. Yung I don't know if you've heard of a Lucas CPR machine. It's like a jackhammer. So ipine-place namin yun sa chest ng pasyente, and then yung board niya sa likod is like carbon fiber, so we can still X-ray through and through the chest whilst it's pumping. It's doing a
Wow.
CPR.
Interesting yun.
Another thing is a balloon pump. So an intra-aortic balloon counterpulsation pump. So it helps the heart to when it comes to hirap na yung heart sa pagpapump, sa pagpe-perfuse ng organs, merong extra parang push. So it's like a femoral approach, and then you insert the balloon pump. If the surgeon or the cardiologist can't intervene, then you still giving the patient a chance to have a leeway, like for surgery or ICU admission awaiting surgery. So yun po.
Ayun, Brian. So, yung area mo, di ba, pag sa OR tayo, mayroon tayong circulating nurse, mayroong scrub nurse. So, ano yung role naman ng cath lab nurse pag may procedure kayo?
Very interesting question po, sir. So, there are at least 5 to 6 personnel in a cath lab, inside and outside the lab. So first, sa labas muna tayo, control room. So in a cardiac catheterization procedure, so angiogram, you have a monitoring personnel, which is a cardiac technologist. You have a radiographer who controls the machine and the slides, the pictures. And then inside, you have a scout or circulating nurse. You have a scrub nurse. You have a doctor, or a doctor plus an assistant. So yun po.
Ayun, Ryan. So yung mga pasyente natin, bago mag-start ng procedure, ano ba yung mga in-assess muna natin sa kanila? Ano yung mga diagnostic exams na dapat gawin sa kanila?
So yun po. So before cath lab po, they will try sa ward setting or sa from home consultation setting. They will try to minimize the invasive procedures. So if you can do it medically, why not? But before that, before cardiac catheterization, nakapag stress echo ba? Nakapag ECG, bloods, what are the medications, history, nakapag CT angiography, kasi yun yung less invasive eh. So CT angiography is like a picture of your coronary arteries or your the surrounding structural area. Pero ang nangyayari po is parang hindi siya convincing minsan. Kaya the golden test, kumbaga, is cardiac catheterization. If we go to vascular, the peripheries and vasculature, isa rin magandang parang tool ang angiography, kasi minsan sa Doppler ultrasound they will show some false stenosis, some false diseases. So yun, parang minimally invasive pero hindi siya open surgery.
Okay. So yung bang procedure nyo, kino-consider ba natin yung age ng pasyente?
So wait. Ano po yun, sir? Sorry po.
Kanilang edad ba ay kino-consider natin sa procedure?
Oh yes, it's a big factor kasi sometimes why would you do an angiography to a 35-year-old patient if they only have history, they only have this and that, like some sedentary lifestyle or anything. You have to consider the risks and benefits, kasi sometimes you can induce heart attack in a coronary angiography. So yun po yung mga parang dangers, and wini-weigh siya ng cardiologist. Ano ba ang mas maganda para sa'yo? So, going back to assessments, tatanungin, ano ba yung gamot mo? Are you on blood thinners? Are you on any cardiac medications? Before we proceed to this procedure, have you taken your blood thinners? Have you stopped your some strong blood thinners? Parang ganun po. And then kino-consider din namin yung parang kidney status ng pasyente kasi contrast is very harmful siya sa kidneys. We use a lot of contrast. And minsan tinanong ako ng pasyente, ano ba ang safe level ng contrast? Sabi ko, to be honest, 0. Because your body doesn't need it. But you have to, just to visualize kung ano man ang nangyayari sa coronary arteries mo or sa peripheral vasculature mo.
Wow. So, ibig sabihin pala, Brian, involved yung patient natin sa procedure na gagawin sa kanya.
Involved sila. Like, parang, dapat, ang maganda sa pasyente, parang perfect patient is a good historian as well. Yung walang dementia.
Para, siyempre, yung assessment, galing din sa kanila, di ba? Verbally.
Kasi ano po talagang you will say a lot from a patient na
Sorry. Excuse.
You will say a lot sa patient na nagsabi sa iyo na, I had 3 stents in my heart. Sabi ko, when was the last stent? Ganyan. Or are you taking aspirin? Are you taking clopidogrel or tricagrelol? Parang ganon. Yung mga cardiac drugs.
Okay.
Na talagang ina-assess talaga namin kasi may checklist talaga po kami. Like before we proceed, we have to ask you the same questions as the other nurses have admitted you. Parang ganon po. Like double check, triple check, and then sa loob ng room before we proceed to the procedures, we have the surgical timeout. So check yung identification, consent, and everything. So yun po.
So yung surgical timeout, gaano ba kahalaga yan, Brian?
Ano ba yun, sir?
Yung surgical timeout, gaano ba ka-importante yan sa atin?
It's a very it's like a standard na actually. It's like a list na you know who's treating, who's inside the room. Do we have the equipment that we needed? Na-sign ba ang consent? Do we have the right diagnostic materials na na-produce ng pasyente? Do we have any concerns sa pasyente? Any anticipated emergencies? So it's really vital yung surgical timeout kasi standardized siya parang ini-recommend siya or pinapatupad siya ng WHO for safety of everyone kasi what if you operated on the wrong limb?
Tama.
So yun.
So Brian, nagbabago ba ang setups nyo kapag mga emergency cases?
Yes sir. Ganito yan, nababypass minsan ang timeout. There are exceptions to the rule, especially kunyari ang mga STEMI. Kasi dito yung ambulance they can bypass emergency department if deemed na chest pain, ST elevation, magsusuka na yung pasyente, diaphoretic na cold clammy na yung pasyente, like they've got all the classical symptoms kasi yung mga paramedic dito, they have the right to give some drugs like heparin, aspirin, morphine straight away. They are trained for that, and then so pag emergency nasa stretcher yung pasyente diretso sa table.
Wow. So paano pala ang consent niyan?
Ang consent is verbal. You will put in the timeout sheet, you say acute, like a big cross. Let's say acute. And then the surgeon or the interventional cardiologist will sign his name and then he will write verbal consent by the patient or the family.
Okay. So, pag mga emergencies ba, saan galing ang pasyente nyo? Nasa ward o sa community o nasaan galing?
It's a very interesting question, sir.
Mhm.
So, ang community, nursing homes,
Mhm.
and inpatients, mas malala, sir, pag inpatient kaysa galing sa community.
Ganun ba?
Kasi, sir, yun nyo, may sakit na, atakihin pa sa puso.
Kaya nga, no?
Kasi yun yung mga parang parang I have chest pain. Tapos parang na-neglect minsan ng staff, or not necessarily staff, but sometimes it's the patient themselves
Mhm.
na nag-complain ng chest pain. And then kasi dito meron kami parang medical emergency team criteria na if they say chest pain, you have to call the emergency team
Parang yung
just
mga
to.
code, ganun.
Yes, code. But iba pa yung code, sir, eh. Kasi
Iba pa yun?
iba pa yung code dito,
Mm.
merong parang pag na-reach mo yung threshold na, let's say, you have chest pain without the relief of nitroglycerin, call a med call, and then the medical fellow will come up and assess the patient, do an ECG, do bloods and everything. And then if it's deemed a heart attack, activate cath lab straight away.
So, Brian, kung halimbawa may mga emergency, di ba, mga cases nyo, yung ba yung cases sa community tsaka cases sa inpatient ay minsan nagkakaiba sila o parehas din?
So it varies talaga, sir. Kasi you have to remember, cath lab is not only for coronaries. You have to do vascular. You have to do EP, which is electrophysiology, and then we have to do interventional radiology as well. So yun yung sa area namin. I don't know about other cath labs, pero sa amin, as a private not-for-profit institution, so first, pag cardiac is you have to know is the coronaries or structural heart. Kasi minsan pagka sa coronaries, given yun, STEMIs, blockages. Structural heart, sometimes kasi yung may mga tamponad, so kailangan mo ng pericardiocentesis, so medical emergency din siya. Sometimes pagka naman isa pa fractural is it's not so emergency, pero kailangan ng pasyente is yung binabalon namin yung aortic valve, which is called balloon aortic valvuloplasty. So kailangan nating iibsan ng hirap yung puso kasi stenotic yung aortic valve nila. So na nagko-cause ng congestive heart failure. So another thing is kapag ka naman electrophysiology, kailangan ba ng pasyente ng pacemakers? Kasi lalo na kapag complete heart block, it's a medical emergency, heart rate nila is like mga 29.
Wow.
Yep, you have.
Baba.
It's an emergency, so you have to put a pacemaker, even temporary pacemaker or a permanent pacemaker. It doesn't matter as long as ma-salvage yung pasyente. So yun. Another thing is nagda-direct current reversion din kami, DCR. So yung pasyente may mga AF, so as a first line of treatment, if applicable sa pasyente, sinashock namin. Pero tulog yung pasyente.
Okay.
So yun, at wag kakalimutan daw, lagi sinasabi sa amin, don't forget the sync button. Kasi pag hindi mo sinink at sinak mo yung pasyente, BF or BT yung pasyente. So yun, yun yung isang role ng cath lab nurse. If you wanna push the button, you have to know what you're doing.
Alright.
So yun. Tapos pag vascular naman, we're dealing with ischemic peripheral vasculature. So let's say may ischemic leg, mapuputulan ang paa yung pasyente pag hindi mo tinreat yan, or magkakaroon ng dying limb, kumbaga. So hindi siya perfuse, so i-unblock namin yung ano para po sir kung ipipikit niyo yung ano yung mata niyo para lang kaming tubero. Kasi puro ano para purong ano talaga plumbing talaga ang ano ang ginagawa namin like susundutin mo, paluluwagin mo, ire-repair mo. So
Ganun lang ang
yun.
layman's term natin dyan.
Mm, mm.
Kasi may mga bara-bara yan eh. Kailangan
Yes, sir.
sundutin yan,
Mm,
alisin yan,
At yung
tunawin yan,
equipment,
kailangan.
yung equipment, the cost of ng isang procedure sa cath lab, it's like if you have to think about it, bigyan ko kayo ng isang scenario like ang isang stent is like 1600 Australian dollars, which is around 1,300 US dollars per stent.
Wow.
And if the patient needs at least 5 stents just to salvage the artery, why not? What would you rather? Kumbaga, mapalala mo siya, have an open heart surgery, or if you're candidate for a coronary angiography and stenting, then might as well do it.
Ayun, Brian. Total, nabanggit mo yung price niya, ano? Yung ba ay ang mga pasyente niyo ba dyan, yung mga insurance? Or paano pag walang insurance?
There's two scenarios po, sir. Sa Australian, dito sa Australia's healthcare system, you have a public, so government hospitals, which is paid by Medicare. So Medicare is a system na the government pays for your medical bills. At wala kang ano, parang hindi ka magko-copay, wala kang down, missing ka, wala. Just to share po, I've been operated on appendicitis here sa Australia. I didn't pay anything.
Wow.
Yep. And pagka naman sa public, may waiting times din, like Canada. Canada's got a good healthcare system, free, pero may waiting system siya. So kinakategorize, tinitriage din. So kung ano yung category ng pasyente, is it emergency, semi-emergency, and ayun, makakapag-wait pa to ng 3 months, ganun.
3 months to 1 year, mga ganun.
Ganun. Yung mga hip replacements, yun, mga 1 year yun. Tapos pag naman private, dito papasok yung private healthcare insurance.
Okay.
Yan. Doon pumapasok yung doon nagbabayad ka ng premium for your para maka-jump ka sa line, maka-jump on the queue ka. Like kung may kilala ka na surgeon, why can you please operate on me? I'm hurting. Ganun. Ganun lang. Like private talaga.
Maganda pag private.
Yun sir. Pero meron naman na out of pocket, talagang hindi na matiis, they will pay in cash.
Okay.
Yeah.
So Brian, yung area mo, gaano ba ka-challenging yan? Hindi lang sa area mo, Siyempre, may mga kasama tayo dyan.
Yes.
Paano bang scenario pag ganun?
It's a very challenging, sir. You have to look into yourself first. Are you up to the challenge na when you go, you have to prepare everything for your shift, all the equipments, you have to check all the safety equipments, the list of the operation, the type of operation, the type of procedures, sino yung mga makakatrabaho mo, who's the in charge, what extra help, ano pa yung agenda na meron ka. So it's like every morning, ako in my experience at saka lagi kong ginagawa, I always go back to my principles and fundamentals every day, just to be sure na I'm in check. Parang fino-foresee ko na, let's say I've got an endovascular aneurysm repair, AAA. Okay, I have to make sure that I have the right equipment, Prosthesis, is there a company rep coming in?
Mhm.
Is the surgeon will be on time? Is the patient okay? The checklist ba niya is okay? Sino yung who decided to scrub or scout? Kasi may mga evaders din eh. May mga evaders din kasi
Ganun ba?
saka yung sir, you have to assess din yung skill mix kasi may mga cath lab nurses din na I'm not happy or I'm not ready to do this kind of procedure.
Mm.
Ako naman, ang ginagawa ko is like you can watch or you can double scrub with me para makita mo. So next time, monkey see, monkey do. Ganun.
Okay.
Yung baga, you're not just keeping it to yourself. You try to empower din yung yung team
Tama
nyo.
mo. Team.
Kasi ang ganda ng team kung ang lahat parang all around. Kasi ganun tayo mga Pilipino eh. So we try not to say no. Kumbaga parang
Kaya nga.
sige, laban, ganun.
Mm.
Fake it till you make it. Kumbaga. Pero yun nga sir, pero yung base knowledge nun, kailangan very challenging din kasi kailangan alam mo talaga. And then professionalism wise, dito sir, ang mga doktor are very nice. Siguro na-experience nyo sa Ireland, they're very friendly. Nakikipagkwentuhan pa sa'yo, anong result ng football game, ganyan.
Oo, tama.
Tapos ano plano ngayong weekend? Ganun. Kumbaga nakikisakay ka rin lang. Parang tapos minsan may mga times na social events na makakainuman mo pa sila, makaka-dine in mo pa sila. Ganun sir. Kumbaga you have to develop your own rapport din. Not only for the patient, but the people around you. So yun. Another challenging din is yun nga, yung lead. Yung lead. Sa ibang institutions kasi sir, binabayaran yung time mo na naka-lead ka. May lead allowance ka. Kasi hazard siya eh.
Oo.
Hazard siya. Kumbaga, you'll develop, marami akong nakita, nagkaroon ng mga bursitis, nagkaroon ng mga problems sa paa, sa neck, sa legs, sa shoulders, sa back. Kasi talaga mabigat, literal na mabigat.
Bigat,
But ang rewarding dyan is I always think of I helped someone, which are the doctors, to give someone a second chance in life. Ganun na lang. Kasi heart is a precious thing.
Exactly.
Napaka-precious niyan. And yun yung kumbaga bakit ako tumagal sa cath lab? It's because I love what I'm doing. It's very hindi ka man direct patient care, but you're part of the team na nakatulong to sa pasyente. It's very emotional din sir, minsan. Sobrang emotional.
Kumbaga,
hindi naman siya drama siya sir. Hindi siya Grey's Anatomy level na drama. But you do it in the sidelines, kumbaga. Kumbaga, may mga pasyente na hindi maganda yung outcome, parang naging emotionally attached ka din sa pasyente. Kasi like, makikita mo, nakikipag-chat lang sa'yo yung pasyente mo sa holding bay kung saan mo ina-assess yung pasyente bago mo ilagay sa table. And then, kinalaunan, hindi pala nakasurvive yung pasyente.
Yun, ang mga challenges talaga dyan sa area mo, Brian.
Yes. Tapos, may mga challenges din na parang ayaw mo namang i-overstep yung doktor. Pero kasi ang dami mo na nakatrabaho mga doktor. You have to remember sir sa area namin is like you have at least 20 consultants to work with.
Oh, dami.
And yung 20 consultants na yun, may mga preferences sila.
Iba-iba yun eh.
Ibang bisyo at gawi nila.
Mm.
Grabe. Meron kaming diary. Saka para spreadsheet na anong gamot ang gusto niya. Anong catheter yung una niyang gagamitin. So that's one of the challenges, knowing your doctor themselves. So talagang it took me parang ang progress ko diyan is like it's a learning curve in a very in a very shallow to a very steep curve, like from zero to hero talaga. Kasi parang start niyan is like ilalagay ka sa sa area na kumbaga challenging pero less stressful. And then mamaya after a year nasa mga acutes ka na. Like yung super emergency, like time critical. So yun. The urgency is another challenge, sir. The urgency. Like yung critical thinking is like you have to think in a split second na do I have to do this? Do I have to tell the doctor this ECG na kasi minsan ang mata ng doctor is sa ginagawa niya. So you're the second set of eyes. So you have to be aware then. You have to think na kailangan ko siyang tulungan para mapadali yung trabaho niya.
Yeah, of course. Nasa team ka din eh. Oo. So Brian, parang yung sa area mo dyan, parang nasa comfort zone ka na. Kumbaga wala ka ng kaba, kabisado mo na lahat. Ganun ba?
Meron pa din, sir. Meron pa din. Kasi you'll never know kung ano ito-throw sa'yo ng case. Kasi minsan, give you a prime example. Sa endovascular access kasi, sir, ng aneurysm repair. So, dalawang puncture sa groin through the common femoral artery. Paakyat yan para i-repair tong aorta. Ngayon, meron kaming closure device na ang mangyayari is para magiging keyhole lang. Instead na malaking laparotomy, dalawang maliit na butas either side ng groin.
Okay.
So less invasive, di po ba? Pero naipasok mo yung graft sa loob para ma-repair yung aneurysm. Paano pag hindi mo maisara yung common femoral artery?
Yun lang.
So, kailangan meron ka ring theater skills, may OR skills ka din na makakapag-handle ka ng instruments, makakapagbigay ka ng sutures and makakapag-hold ka ng mga retractors, alam mo rin ang mga instruments mo. So, parang ang nangyayari is yes, you can do endovascular, but can you do cut downs? Parang ganun sir ang parang titingnan ka talaga na alam na manager mo na you can do this, go right ahead and scrub it.
Ayun, Brian.
So
Brian, sa isang case ba, ilang oras na tatapos yan?
Sa isang case, ang normal coronary angiogram po is 15 minutes. That's diagnostic. But if you have to put a stent, so let's say, depende sa doctor din, 45 to an hour and a half, sometimes even more. Ngayon, sir, nakakapag-replace na kami ng valve through the groin.
Wow.
So aortic valve, marireplace mo siya. Instead of an open heart surgery, may tinatawag kami transcatheter aortic valve intervention. AVI.
Very interesting area mo dyan.
So structural heart, coronaries, vascular, EP, so mga pacemakers and ablation. I won't go too far sa ablation kasi yun sa treatment ng mga heart rhythm irregularities, which is very very nerdy at very very technical. It's more of electrics talaga. Yun naman ang mga electrician. Tubero, electrician. Yun. So 20 to an hour and a half, depende sa situation. Ang transcatheter aortic valve implantation, an hour and a half to 2 hours instead of a 14-hour surgery.
Wow.
Or a 6-hour surgery. And then sa aneurysm repair, depende rin sa surgeon at depende sa anatomy and pathology ng pasyente, 45 minutes to an hour and a half. So yun po.
Okay. Okay. So pag mga
Pero
long,
ang tanong sir dyan is gaano kalaki yung list? Gaano kadami
yun nga.
ang pasyenteng gagawin?
Ayun nga, yung sunod ko na tanong sa'yo, gaano kadaming pasyente na kino-cover nyo sa shift mo?
Averaging po is 25 of mixed cases.
Oh, ang dami.
We have 4 labs running. So
Okay.
2 coronaries and then cardiac labs, 1 endovascular, and then 1 hybrid lab. Hybrid means you can do an open surgery, you can do endovascular surgery.
Wow. So, speaking of naman to, Brian, yung charting nyo naman. Paano charting
Charting.
yan?
Masaya kasi wala. Sabay
Ng
ganun eh.
charting.
Hindi, meron din sir kasi we do isa pa ring area ng cath lab na hindi ko na babanggit is recovery. We do recover patients too.
Okay.
So the
So,
normal
patient mo rin sa recovery.
minsan sinusundan mo eh pagka wala ka nang gagawin, ikaw yung circulating nurse o ikaw yung scrub nurse. Susundan mo yung pasyente, ako rin na magre-recover sa'yo. Parang ganun.
Wow.
Ikaw din ang transport minsan. Pag walang orderly, ikaw din ang tagapag-drive ng bed. Saan pa kayo?
So, paano pala pag long case? Paano break time? Meron
Break time.
papalit kayo or paano?
Ako, sa area namin, kasi, so dalawang break. So in a 10-hour shift, dalawang break. So first is morning tea, morning break, 15-20 minutes. Pero legally 10 lang. Tapos yung second break, lunch break is half an hour. And then yung sunod mong break kung hindi busy, may afternoon tea ka pa rin. May afternoon break ka pa, 10 minutes, 15 minutes. Yung
ba, Brian, yung tea break nyo, pwede magkape? Joke lang.
Talagang iba, Yossi break. Yung iba, blood.
Hindi sa literal na tea break talaga.
So, tea break. Talagang tea break. Talagang parang nagtsaka lang at saka nagbiskwit. Skyflakes.
Ganun sa kanila, ano? Doon sa Europe, ganun din eh. Tea break din sila eh.
So, yun. Depende rin. Pero minsan ako, personal preference, pagka long cases, let's say 8-hour case, mga complicated cases, I don't ask for a substitute or I don't kasi parang magugulo yung patas ng mga instruments ko. Pero personal preference lang, sir. Yun ang iniiwasan ko kasi parang baka magulo yung yung organization ko ng mga equipment ko. Yun ang kinakatakot ko minsan kasi ako yung parang mawiwindang. Kumbaga.
Kasi yun ang routine mo eh.
Yes, sir.
Yun ang routine mo kasi pag minsan may isang instrument lang yan na nawala sa area mo,
sira na.
Tapos, may ganun akong kasama.
So, minsan, naghanapan pa kami ng suture eh. Naghanapan pa kami ng suture. Yung suture nasa floor pala. Minsan yung suture na kasing haba lang ng pilik mata mo, yung mga 5-0 Prolin.
Grabe, no?
Grabe. Hirapan namin yun. Talagang may magnet talaga kami.
Talaga?
Talaga may magnet. Para dumikit lang. Yung needle holder yung needle counter namin. Yung lagayan ng sharps, may magnet siya. Para lang kasi nga advanced na mga hospitals, halos lahat disposables eh. Yun ang nakakainis, yun ang heartbreaking minsan kasi kung nasa Pilipinas to, na-recycle na to.
Sinabi mo pa.
Kasi meron kami dito, sir. Ewan ko kung na-experience nyo sa ibang bansa to, na disposable ang mga artery forceps saka mga gunting, mga scissors.
Grabe, no?
Kasi mas mura pa daw ang magtapon kaysa sa re-sterilize.
Ay, kaya siguro ganon.
Kasi yun namang mga disposable na instruments, they're like like parang hindi talaga siya magtatagal ng 1 year or 6 months.
Okay.
Mm. So yung mga stainless steel pero hindi siya high quality na mga instruments. Na pwede pang
Brian,
i-sterilize sa Pilipinas.
just realize, pero gabayad pa rin yung mahal pa rin eh. Pero minsan may mga machine naman tayo doon. Doon na lang yung autoclave, yung ginagas, mga ganun. Pero ganun pa rin. So Brian, may iba naman tayo. So pag day off ka, Brian, ano naman ang yung mga gimmick dyan?
Ayun, bukod sa uminom, hindi, sir, nag-aalaga ako yun, bata, school run, housework, yung normal chores ng life. Ginagawa ko pagka may time, nakapagbasa ako. Or yun nga, tapos may mga books ako, saka pina-follow sa YouTube na mga whiskey and cocktail making channels.
Na ano ba yan? Bakit nag-ano ka ba? Nag-bartender ka rin?
Sideline ko yun, sir.
Talaga?
Nag-ano ako.
Kumikita ka rin?
Kumikita din ako. Paid by the hour.
Wow, grabe. Bigyan mo nga kami ng sample dyan. Ano ba yung paborito mo?
Hirap sa ng ito yung lagi tinatanong ako, sasabihin sa akin, what's your favorite drink? Sabi ko, look, I don't have any favorite. My favorite is the next one.
Pero bigyan mo kami ng cocktails mo dyan para matry ko din dito.
May mga simple lang, sir, na kumbaga widely available ingredients and super simple to make. Pwede kang makapagawa out of a jar. Kumbaga.
Talaga? Pwede magamit sa party?
Yes, sir. Pwede mong gawin siyang batch, pwede mo siyang gawin on the go para ma-impress mo yung guests mo. So yun. Yun, sir. Dito, ang Melbourne is all Australia, culinary capital ang Melbourne. So, hindi ka uulit ng isang restaurant sa isang taon.
Wow. Kung sarap pumunta dyan
Kasi yung diversity, sir, dito.
Oo.
May mga katrabaho kami, iba't ibang lahi. United Nations kami. Pero dominated ng medical field talaga is Filipino, Indian, Chinese, and other nations. So, yun. Mahilig kami sa mga public holiday dito. Mga bank holiday.
Marami ding holiday dyan.
Marami holiday dito. So, celebrate namin yung Queen's birthday.
Last time,
So, yun. Tapos, ang dito, yung kagaya na sabi ko kanina, sir, ang work-life balance dito kasi ang leave dito is you accumulate in hours.
Okay.
Let's say ako na-accumulate ako ng 250 hours. So i-divide mo siya per day. So 8 hours or 10 hours a day. Yun yung number of days na leave mo.
Okay. So mahaba yun.
Mahaba, sir. Like pwede kang tapos after 10 years na service mo, continuous service, may long service leave ka, pag full-time ka, 17 weeks paid.
Sarap. So, 10 years ka na dyan. Ilang years na lang para mag 10 years ka?
Malapit na, sir.
Malapit na. So, yun ang mga benefits mo dyan. So, pag holiday ba, na-increase sa sweldo?
Sa amin kasi,
may double pay.
Shut ang department kapag public holiday. Pero, bayad ka for that. Bayad ka for that day na hindi ka pumasok. Pero kapag ward nurse ka, triple pay.
Wow, ang ganda.
Triple pay pagka public holiday. Pero yung kung sa mga benefits naman, sir, education, isa yun. Sa public hospital, napakaganda ng education system nila para sa mga nurses. They would sponsor someone Kagaya ni Mrs. for example, ni-sponsor si Mrs. just to have a diploma in management.
Wow.
Yeah, binayaran ng hospital. May portion lang na binayaran si Mrs. pero maliit lang. They would like you to excel talaga. They would support you. I-encourage ka, hindi ka pepersahin, pero i-encourage ka na to take up a higher education. Because why not? Maganda ang pasok ng pera. So put it into good use. They would sponsor scholarships. And another thing is like ako, minsan nakapag Sydney ako conference for vascular surgery, all expense paid.
Wow. So, mag-stay ka sa hospital nila, di ba? Pag-sponsor ka nila, mga ilang years yun?
Na mag-stay ka? 18 months. 18 months lang. 18 months lang. Yeah, 18 months lang. Otherwise, ibabalik mo yung ginastos sa'yo.
Ayun, Brian. So, itong pandemic natin, paano mo ba hinaharap ito, lalo na sa area mo?
Ako, mabusisi yan, sir.
Konti lang.
Start tayo sa screening. Kailangan, nung during the pandemic, negative PCR. Bago ka ma-operate. Pagka-acute, walang PCR, syempre, hindi ready eh. Kasi heart attack yan. I-cater mo pa rin siya. So, full gear N95, all battle gear kami. Na PPEs. And then, yung area namin, so, lahat yan, plastic.
Oh, wow.
Na plastic siya.
Covered talaga.
Oh, within half an hour, kailangan mong gawin yun. Kasi, you have to remember, sir, door to balloon time. It means pagpasok ng pasyente sa emergency department or if you've been called by the ambulance, you have half an hour.
Wow, tagal-tagal din.
Maiksi nga, sir. Maiksi siya. Maiksi siya. You have half an hour. Kailangan mailagay mo ang pasyente sa table within half an hour. Otherwise, mamatay pasyente.
So, mabilis pala.
Or malaki ang damage sa heart ng pasyente.
Tama.
So yun. Another thing is yung pag ikaw ang nagka-COVID, so ewan ko kung nabalitaan nyo, Melbourne is the most lockdown city in the world.
Oo nga, oo.
Yun. During the kasagsagan ng pandemic is like kami nagra-random PCR testing kami. Pagka na-expose ka lang, kasi may contact tracing din, pag ma-expose ka lang sa isang area, 14 days off ka. Bayad yun ng gobyerno.
Dati yun, pero ngayon
wala na. Ngayon magka-COVID ka, 7 days na lang ang isolation. Tapos, kunyari, ang kasama mo may COVID dito sa bahay, daily, tapos ikaw, kailangan mo pumasok sa trabaho, daily rapid antigen test lang. If you're asymptomatic, just go to work. Kasi kulang ang nurses.
Napakaganda ng mga paliwanag mo, Brian. Tsaka words of wisdom, mga experience mo, sinishare sa amin, Brian. So, medyo patapos na tayo, Brian. Ito na lang tanong ko sa'yo, no? So, ano yung advice mo sa mga nurses natin? Pag gusto maging cath lab nurse naman, gagaya mo?
I would say, start from the fundamentals of nursing. Ward nursing, medical or acute surgical. Gather some experience. A bonus is a theater experience as well, operating theater. Just be resilient and always go back to the principles kasi it's very important. At saka you need a bit of luck. Sabi nga nung isang surgeon is you don't need a good surgeon, you need a lucky surgeon. Kasi sometimes no matter how good you are, if you don't have a bit of luck, Wala talaga.
Tama. Sabi
Yan.
kasama yung luck yun eh.
Yun. Saka yun nga. Kasi isa ring parang regret ko is hindi talaga ako nag-aral nung nung college ako. Like hindi ako nagpursige nun eh. Siguro mas marami pa akong alam. But I think university studies is only just tip of the iceberg for all of your nursing. Kasi you learn as you go. Kumbaga.
Ako dyan. So, hindi lang kasi marami ka pang ma-experience eh. Along the way, di ba? Habang nag-start ka ng nursing mo, nag-ipon ka, yung mga foundations mo, and then,
Yes.
isa makuha mo na yung pinaka gusto mong area. So, Brian, kagaya mo, nasa Cath lab ka na. So,
and sometimes yung area na yun nangahanap sa iyo eh. Kumbaga it's just everything happens for a reason, kumbaga. Parang ikaw mismo ang hahagilapin ng na yun, ng area na yun.
Ayun, Brian. Pare, maraming salamat sa iyo ha. Ang dami mong na-share sa amin at baka meron ka pang gustong i-shoutout dyan. Nakalimutan mo bago tayo magtapos.
Thank you sir for the opportunity.
Ako, thank you din at nagkaroon ka ng time para sa ating Global Nurse TV.
Yeah, thank you. So kumusta kay Mrs., kay Mariel, and sa baby nyo. And yun nga, ulitin ko yung mga katropa ko nung college, na Julius, Marion, Edwin, Gian, Nordic, Nico,
natin sila dito.
And everyone. Yep. Get into it. Yan. And
sabi nga, sharing is caring. Mag-share naman sila ka mo.
yeah. Ayun sir, sa akin naman is sa inyo, good luck sa future endeavors nyo dun sa New York. I've seen New York once and it's a nice place to visit, and I'm not sure about the outer skirts from New York City, pero I like New York. So ayan, one time
ka dito.
I would come back na hindi winter.
Yun, summer, ganito, magandang panahon, maganda.
Yeah, winter ngayon sir, as you can see, tinan mo naman, balot ako. Ayun.
Yun, Brian, so day off ka ngayon? Day off?
Day off ko ngayon, so naka-annual leave ako. So yung naipon ko na annual leave is ginagamit ko for the family and for myself para ma-rehabilitate din ang mga sumasakit kong katawan.
Kailangan, relax din.
Ayan, so at saka yun nga, nagkakaroon ako ng time para makapag dust off ng mga bote din.
Padala mo ako ng isa dyan.
Madami dyan, sir. Madami dyan.
Yun, Brian. So paano, sir? Salamat, Sir Brian, sa iyong time. Nako, marami kami natutunan sa iyo. Cath Lab Nurse, Sir Brian. Sir, saludo kami sa iyo.
Thank you. Thank you very much.